Let me tell you something I hear from almost every single buyer I work with who's thinking about relocating to Kitsap County. They ask me about the schools. They ask me about the commute. They ask me about what neighborhoods have the best value. And then, usually at the end of the conversation, they lean in and they ask the question they've been somewhat nervous to ask the whole time. What's the healthcare actually like out there? And what they're really asking is, am I going to be giving something up? Will I be far from my doctors? What happens if something serious happens? So if you've asked that question, or if it's been sitting in the back of your head, this video right here is for you. I'm going to walk you through the full picture, the hospitals, the primary care reality, the specialist landscape, the military healthcare network, the honest gaps, and a practical plan for getting yourself set up before you ever change your address. Here's what most people assume before they research Kitsap County. They assume that moving to a smaller area, especially one that's a ferry ride away from Seattle, means accepting a downgrade in healthcare access. They picture a small community hospital with limited capabilities, primary care practices that aren't accepting new patients, and anything complex requiring a 2-hour drive. And honestly, that assumption is partially correct, but only partially. Kitsap County has a fully functional acute care hospital system anchored by St. Michael Medical Center in Silverdale, part of the Virginia Mason Franciscan Health Network. You have a growing network of clinics, specialty practices, and urgent care centers. You have Naval healthcare infrastructure for one of the largest military populations in the Pacific Northwest, and you have a 30 to 60 minute connection to the full Seattle medical ecosystem, which is genuinely world class. But there are real gaps. Primary care access is tight. Certain specialist categories are thin or require Seattle referrals. Mental health access has meaningful wait times, and these are not deal breakers, but they are things you need to know and plan for. Hey, I'm James Bergstrom, owner and broker of Paramount Real Estate Group right here in Kitsap County. I've worked with hundreds of buyers through this relocation process. Healthcare is one of the most common concerns I hear, and so today I'm giving you the real version. Here's what we are covering. 1, the insurance network trap that can catch you completely off guard before you move. And 2, what St. Michael Medical Center can actually handle. 3, primary care and the panel is full problem in the Pacific Northwest. 4, the specialist landscape, what's local and what routes you to Seattle. 5, military healthcare, Naval Hospital Bremerton and TRICARE. 6, mental health and specialty gaps, the honest reality. And 7, the 5-step healthcare setup plan before you move. Let's get into it. Before we talk about a single hospital or doctor's office, I need to tell you about the thing that blindsides more relocating buyers than almost anything else in the healthcare conversation. The insurance network trap. Here's how it works. You have a job you're keeping when you move, and that job has a health insurance plan. You've been on that plan for years and it works great. Your doctors are in network, your prescriptions are covered, everything is fine, and then you move to Kitsap County. And then you discover that your employer's plan, which was built around providers in your current city, has almost 0 in-network options in Kitsap County. Or the main hospital is out of network. Or your specialist category isn't available in network within 50 miles. This is not theoretical. This happens, and when it happens, it can mean out-of-pocket costs that make the lower cost of living in Kitsap look a lot less attractive. So before you buy a house in Kitsap, before you even get serious about the search, you need to do one thing. Call your insurance company and ask specifically which providers and facilities are in network in Kitsap County, Washington. Specifically ask, is St. Michael Medical Center in network? What primary care physicians are in network in the area I'm considering? Do I have in-network access to specialists locally? If the answer comes back thin, that's not a reason to not move to Kitsap, but it is a reason to have a conversation with your HR department and factor network changes into your relocation timeline. So 5 minutes on the phone before you put in an offer can save you thousands of dollars afterward. That's the first step. The flagship hospital serving Kitsap County is St. Michael Medical Center in Silverdale. It's a full-service acute care hospital that is part of the Virginia Mason Franciscan Health System, connected to Common Spirit Health, one of the largest nonprofit health systems in the whole country. So when you're walking into St. Michael Medical Center, you're not walking into a rural community clinic. You're walking into a hospital connected to a major regional network with real resources. Emergency care. St. Michael runs a 24/7 emergency department with a level 3 trauma designation. They handle the vast majority of cases with the seamless ability to transfer highly complex trauma or cardiac cases directly into their larger network. Flagships like St. Joseph in Tacoma or over to Harborview Medical Center in Seattle when a level 1 facility is required. That transfer capability is built directly into the regional layout. Maternity. Full family maternity center on site, labor and delivery, NICU capabilities, cancer. St. Michael has an on-site cancer center. You can receive a significant portion of oncology treatment locally without going to Seattle for every appointment. Cardiac. They have a cardiac catheterization lab on site. Emergency cardiac intervention can happen at St. Michael without a helicopter transfer to Seattle. The bottom line on the hospital question, Kitsap has a real hospital with real capabilities, not a level 1 trauma center, not a teaching hospital, but a solid, full-service facility connected to the Pacific Northwest's strongest health network with clear pathways to Seattle's world-class systems when you need that next tier. Most people, most years, never need anything St. Michael can't handle. Real quick, if you're watching this because you're actually thinking about making a move to Washington State, I put together a free Washington State relocation guide that walks you through everything you need to know before you pick a city, a neighborhood, or even a zip code. Healthcare access, cost of living, housing, market data, the different regions, all of it. It's in the description below. Grab it before you keep watching. It'll give you a lot of context for everything I'm about to cover. All right, here's a fact about Washington State healthcare that nobody in the relocation conversation tells you. The Pacific Northwest has one of the most significant primary care physician shortages in the whole country. Parts of Kitsap County have been designated as a health professional shortage area for primary care by the federal government. That means there are not enough primary care providers to meet the needs of the population. This is not unique to Kitsap. It affects most of suburban and rural Washington State, but it has real practice implications for anyone moving here. The most common experience for new residents who need a primary care physician, they call the first several practices they find and they hear the same thing. We're not accepting new patients. Well, this can be genuinely frustrating, but here's what actually works. First, Peninsula Community Health Services is a federally qualified health center with relocations across Kitsap County, Bremerton, Silverdale, Port Orchard, Kingston, and Bainbridge Island. They tend to have more accessible new patient availability. These are real accredited clinics. Second, the Virginia Mason Franciscan Network operates primary care clinics throughout Kitsap and actively manages a new patient intake. Third, telehealth, teledoc, MD Live, the VMF patient portal. Genuinely useful for non-emergency primary care in the gap period when you've moved but haven't established care yet. Fourth, if you have a specific ongoing condition, establish care before you move. Ask your current physician for a 90-day supply. Get your records, schedule that final visit, and ask for a warm referral to a Washington State colleague. The people who struggle with primary care in Kitsap are the ones who assumed it would be easy to find a new doctor and discovered otherwise after the move. The people who plan for it don't have a problem. Kitsap County has a meaningful and growing roster of specialty medical services. So for many of the most common specialty needs, you either have local access or access within a reasonable drive. Strong local coverage, cardiology, orthopedics, OBGYN, gastroenterology, urology, ophthalmology, and ENT. These are well represented in the county. There's limited local coverage. Well, dermatology and rheumatology have wait times that can stretch 3 to 6 months for new patients. Neurology is thin. Child and adolescent psychiatry is the most constrained specialty category in the whole region. Now here's the framework that matters. Kitsap is connected to Seattle, and that connection is not a compromise, it's a feature. University of Washington Medicine is a nationally ranked academic medical center, and it's approximately 45 minutes from Bremerton via ferry. Virginia Mason Medical Center in Seattle is one of the highest ranked specialty hospitals in the country and has direct referral pipeline from Kitsap through VMF network. Seattle Children's Hospital is nationally top ranked for pediatrics. The practical experience for most Kitsap residents with complex specialty need. They see their local specialist for routine care, and they make periodic trips to Seattle via ferry, which is actually a pretty civilized commute for the high complexity work. If you have a specific ongoing specialty condition, MS, RA, complex cardiac history, identify your Seattle specialist before you move. Get on their wait list early. UW Medicine and Swedish can run 2 to 4 months for new patients. Kitsap County is home to Naval Base Kitsap, the 3rd largest naval installation in the whole country. The veteran population here is significantly above the national county average. This means Kitsap has a parallel healthcare infrastructure that runs alongside the civilian system. And if you're eligible to use it, it changes the healthcare calculus dramatically. Naval Hospital Bremerton, NHBREM, is a massive military healthcare hub right on the waterfront. Active duty service members and covered family members enrolled in TRICARE. This is their main primary care home. Now, keep in mind, it features an urgent care clinic rather than a traditional 24/7 emergency room, but it provides robust outpatient hospital services and an excellent referral network through the military health system. If you're a military retiree using TRICARE, the specific plan you have matters. TRICARE Select gives you more civilian provider flexibility. TRICARE Prime routes you primarily through the military treatment facility, so know your plan before you move. If you're a veteran eligible for VA care, the VA Puget Sound system serves this region. There is a community-based outpatient clinic right in Bremerton that provides primary care and select specialty services without requiring the drive to Seattle for routine visits. Important caveat. Moving between duty stations or changing residency can create transition gaps in VA enrollment and TRICARE coverage. Start your transfer paperwork 60 days before your move date. Don't assume your coverage transfers automatically. I want to be straight with you about this one. The mental health provider shortage in Washington State is significant, and Kitsap is not immune to it. Wait times for a new patient appointment with a psychiatrist in Kitsap County can run anywhere from 8 weeks to 6 months. Child-adolescent psychiatry is the most constrained specialty category in the region. This is a real gap, not a deal breaker for most people, but absolutely something to plan for if mental health care is a current or anticipated need for anyone in the household. Here's what works. 1. Kitsap Mental Health Services is the county's primary community behavioral health organization. They serve all income levels and are a real resource. 2. Telehealth. Washington State has a strong telehealth parity laws, meaning insurers are required to cover telehealth at the same rate as in-person visits for most mental health categories. BetterHelp, Talkspace, Headway, Alma, all active in Washington. Use telehealth as part of your plan, not as a backup. 3. If you or a family member currently receives mental health care, start the search 60 to 90 days before your move and ask your current provider if they can continue to see you via telehealth after you establish Washington State residency. Many can. For child and adolescent mental health specifically, this is the tightest category if you have a child currently receiving behavioral health services. So establishing care in Kitsap should be treated as a high priority logistical step and not an afterthought. Almost everything I've told you in this video comes down to one central truth. That's one. Healthcare in Kitsap County rewards people who plan ahead and punishes people who improvise after the fact. Here's the sequence. Step 1, run the insurance network check. 90 days out, call your insurance company. Ask specifically which hospitals and primary care physicians are in network in Kitsap County, Washington. If the answer is thin, open a conversation with HR about plan alternatives immediately. You have time to fix this before the move. You do not have time to fix it after. Step 2, identify and contact your new primary care provider 60 days out. Don't wait until you're in Kitsap County with a sinus infection to start the search. Run the Washington DOH provider tool. Call Peninsula Community Health Services. Call the VMF clinics in Silverdale. Get on the wait list now. Being on a wait list 60 days before you move means you'll have a PCP within your first few weeks of arrival. Step 3, get your records and your 90-day supply 60 days out. Request a full copy of your medical records. Request a 90-day supply of any maintenance medications. Ask your specialist for a warm referral to a counterpart in Kitsap or Seattle. Warm referrals from a physician colleague carry significantly more weight than a cold call from a new patient. Step 4, identify your Seattle specialist if you need one. And do it 45 days out. If your health situation includes a specialty category that Kitsap covers poorly, rheumatology, neurology, complex cardiology, rare conditions, identify your Seattle specialist now. Get on the wait list early. UW Medicine, VMF Seattle, and Swedish are your main options. Step 5, set up telehealth and crisis resources. Before day 1, create a telehealth account before you arrive. Identify Washington 988 Crisis Lifeline and save it. Know that St. Michael Medical Center in Silverdale is your primary 24/7 ER. Know that Naval Hospital Bremerton handles urgent care for the military-connected community. Have these in your phone before you need them. 5 steps, 90 days, everything is handled, and that's the move. Kitsap County has a real functional healthcare system anchored by St. Michael Medical Center, a full-service acute care hospital connected to Virginia Mason Franciscan Health, a growing roster of local specialists, a strong primary care foundation, legitimate military healthcare infrastructure through Naval Hospital Bremerton and the Kitsap VA Clinic. The honest gaps are in primary care access, which requires early setup, and in some specialty categories, particularly mental health and certain subspecialties where Seattle fills the gap. The insurance network trap is the most preventable problem and the most common one. And the connection to Seattle, which is 30 to 45 minutes by ferry, means that everything UW Medicine, Virginia Mason, Seattle, and Seattle's Children's Hospital have to offer is within realistic range. That's a tier of medicine that people in genuinely rural areas of this country don't have access to. You do. If you came into this video asking whether you'd be leaving behind quality healthcare when you move to Kitsap, the answer is no. Not if you plan ahead. Not if you use the 5-step setup process. So here's 2 things I want you to do right now. First, Washington State Relocation Guide is in the description below. Healthcare access, housing market data, cost of living, the different regions of the state, everything you need to make an informed decision. Free, no spam, grab it. Second, if you have a specific healthcare concern that you want to talk through in the context of a real estate decision, which neighborhoods put you closer to specific facilities, how proximity to the ferry affects your Seattle access, and what the realistic setup timeline looks like for your situation, reach out to me directly. My contact is in the description. I have these conversations regularly, and I'm happy to have it with you. And if this video helped, please hit the subscribe. Drop a comment below telling me where you're moving from and what your biggest concern is about the move. I read every one of those. So share this with someone who's in the same research process. There's a lot more where this came from. We'll see you on the next one.